Hello and welcome to episode 18 of the About IBD podcast. I'm your host, Amber Tresca. I was diagnosed with ulcerative colitis in 1989 and had two-step J-pouch surgery in 1999. I'm currently a content creator at verywell.com, where I write about inflammatory bowel disease and other digestive conditions. My guest on this episode is Brooke Abbott of the Crazy Creole Mommy Chronicles. Brooke has ulcerative colitis and has had J-pouch surgery. Brooke is going to take us through her pregnancy and birth when she was dealing with ulcerative colitis and a medical team that really wasn't on her side. At the end of the episode, both of us give our best tips for how women can better prepare for the birth process and then bringing home that little demanding person that you love so much. Before we get started, one thing, Brooke's son, his name is Jackson, and his nickname is Hippo, so you'll hear us refer to him in that way. And here's Brooke Abbott, patient advocate and founder of the Crazy Creole Mommy Chronicles. Brooke. My crazy Creole mommy. Sometimes it's mommy and sometimes it's mama. Is that right?
Yeah, that's just because Instagram doesn't like me very much. So I had to kind of switch it up, and Pinterest too. But everything else is Crazy Creole Mommy.
Yeah. On Instagram, I had to use an underscore. I don't even know why, because I don't even think that there's anyone else using the other handle. So
it wouldn't let me.
It wouldn't let you.
Yeah, weird.
Yeah. So you're Crazy Creole Mommy on all social media, and your official diagnosis so far is your official IBD related diagnosis.
So far is ulcerative colitis.
Ulcerative colitis.
Yeah.
And you're living with a J-pouch.
Yes.
Now.
Yes.
Okay.
At the moment.
At the moment.
Yeah, I say that because God knows what.
Well, we hope continues.
We hope it continues, but I'm not gonna. If it doesn't, I'm not gonna freak out.
Right.
So.
Right. Okay.
Yeah.
That's good. So take me through when you were diagnosed.
Okay. I was diagnosed in 2008, and then the following year, ta-da! You're pregnant.
You don't even have, I feel like a year isn't even long enough to get used to the diagnosis.
No, it wasn't. It wasn't at all. I wasn't even used to all the medication I had to take.
Yeah.
And I was told that I wouldn't be able to have children.
Right.
And I was on birth control. But I was also on antibiotics and prednisone.
Okay.
At the time of conception.
So you were pretty complicated.
Yeah.
Actually.
Yeah. I had a lot going on.
Yeah, a lot going on.
Yeah.
And you found out you were pregnant because they told you that you shouldn't. You were taking precautions so that you wouldn't.
Right.
And then you found out.
Yeah. I was about 12, 13 weeks.
12, 13 weeks.
Yeah. And I was sick at work and what's going on? What is this? But I was also in the middle of a flare. So I think that's what took me so long to kind of realize that something else was going on.
Yeah.
Other than, IBD.
Well, I think too, the first time you're pregnant, it's not, if you're not trying, you're not looking for it, it's not something that's going to jump right out at you, especially when you've got so many other things going on.
Especially when you've been nauseous for the last year,
Right. And at the time, you were only a year into your diagnosis, you still had your colon, and it was torturing you.
And I was only on, I think it was on Asacol at that time.
Okay.
So, yeah.
Okay.
It was brand new.
Brand new.
Life was, I didn't even understand what ulcerative colitis was.
Yeah. Okay.
Yeah.
So you found out that you were pregnant, and then what did your doctors do at that point?
Well, I didn't have insurance because I had lost my insurance because of my diagnosis.
Yeah.
So I couldn't see the original GI that diagnosed me. I had to get state insurance that still kind of didn't cover everything. And the GI that they recommended me to be perfectly honest, was not an IBD specialist.
Right.
He told me that I had hemorrhoids and that pregnant women got hemorrhoids and I needed to just treat my hemorrhoids.
Okay. All right.
Yeah. 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 Yeah.
I almost feel like I have no response to that.
Yeah. Actually, it's so funny. Hippo's dad, when he heard that, he literally stood up and he was like, and we're leaving. And he walked me out. He was so angry.
Yeah.
Because the doctor, I went in there by myself and I kept arguing with him. I'm like, I don't have hemorrhoids. I know what having hemorrhoids feels like. And I'm in the middle of a colitis flare.
Right.
That's what's happening to me.
Right.
And he kept telling me, well, I don't know that because I can't do a scope. And I'm telling you as a GI that you don't have colitis. You are not showing signs of having IBD at all. He just kept saying that. So he went outside and I guess he was going to get Jackson's dad to try and convince me that I had hemorrhoids. And so they walk in together and I said, he keeps telling me I have hemorrhoids. Speaking of the doctor, I was like, he keeps telling me that I have hemorrhoids. Can you please tell him that I have ulcerative colitis?
Yeah.
And at that moment, he just got up and he grabbed my arm. He's like, we're leaving.
So you were already diagnosed. You had a diagnosis.
Yeah.
You had undergone treatment already.
Yeah.
And he was just like in denial of. Did he do an exam, a rectal, or anything like that to look? He didn't even look.
No.
And how pregnant were you at that point?
That was at 16 weeks because I just was able to get Medi-Cal because I'm in California.
Yeah.
Based on the fact that I was pregnant and I had a high-risk pregnancy.
Okay.
And so that was what they labeled it so that I could have the insurance. And then they sent me to this guy and, I kept asking him if he wanted me to send over my records and he was just, he didn't care.
Wasn't interested in treating you.
No.
Because also at 16 weeks, I don't have data in front of me. I don't know how many pregnant women have hemorrhoids at 16 weeks, but it's kind of a little early for hemorrhoids. It's usually later.
All I had at 16 weeks was boobs. I didn't even have a stomach
nausea or something like that.
And just dizziness.
Right.
An aversion to most food.
Right. Yeah. Yeah. But all of those things.
And his dad's cologne.
Oh, woo! Funny. Yeah. Well, strong smells in general, probably.
That was not cute.
Yeah. So that guy was fired.
Yeah, we walked out. But because at the time, this was pre-ACA, pre-Obamacare.
Yeah. Mm-hmm.
So at that time, I could not pick another GI because I was stuck in this plan. One of the things that ACA has done is allowed people with chronic conditions to treat their chronic conditions however they need to. So if you need to change doctors, if you need to find a way to change medications, it kind of gives you that breathing room. And I didn't have that. So I did, that GI did not mesh with my OB. She tried to figure things out, but because of that whole conflict, I was taken off Asacol because I think she was not familiar with it.
Yeah.
And so she just took me off because she didn't know if it would cause any complications with the baby.
Right. And there's the idea that pregnant women should be off all medication, which is not.
It's not necessary. In fact, I definitely should have been on it, and I would have had a better postpartum life.
So you were receiving Asacol. That's maintenance treatment. How were you responding to that at the time? Well, or
not really?
No,
but I was, and that's the sad thing. I was diagnosed. I didn't really understand it.
Yeah.
Now looking back, I realize I wasn't responding to it. But then I'm just like, okay, well, this is just how it is, and I just got to keep taking these pills.
Yeah. Okay.
So, and it was pretty frustrating that I was still sick.
Right.
Because also in my mind, I felt like, when I take my asthma medicine, I take a breathing treatment, and I can breathe.
Right.
So it should be the same for these 10 pills I have to take.
Right.
Right.
But you had fallen between the cracks because of the lack of insurance at the time.
Well, I was paying cash for everything.
Right. Yeah.
Which on a assistant director's budget,
Yeah.
it ain't cute.
It's not great.
No.
Yeah. And so you weren't receiving care from a specialist. You were not responding to what you were doing. And then somehow your little body managed to catch pregnant.
I mean, you know, it's so funny that the surgeon who took out my colon 2 days after, when he came up for the follow-up, he's having a conversation with me, and he goes, I need to know, did you give birth to your son? I was like, yeah. And he goes, I don't know how you did it.
Oh.
I mean, he was like, I don't know how you carried another human being in that body.
Hey, this is Stephanie from The Stolen Colon. I'm a mom of 2 young kids, and I'm living with Crohn's disease and a permanent ileostomy. I'm inviting you to be a part of the conversation on Twitter for parents with IBD and parents of kids who have IBD. Use the hashtag IBDmoms to join in and to get all of the info on our upcoming Twitter chats. While you're there, don't forget to follow me at smlhughes and check out my blog at stolencolon.com.
It was pretty bad. You had uncontrolled disease. You managed to get pregnant anyway, despite doing all of the things to not.
And went into some sort of remission during my pregnancy, which was a miracle, because I gained weight. I went from being 115 pounds to, by the time I gave birth, I was 196 pounds. All baby. My hair was growing. I had an appetite. I did,
So you were, what they say is that a third of women get better, a third of women get worse, and a third of women stay the same. So you were in the third of women that get better during pregnancy. Interesting.
Yeah.
Okay. So, but they took you off the Asacol. Were you on anything else?
No.
No.
For the first, right after I found out I was pregnant, and then up until, before my 20 week, I was on prednisone.
Okay.
I was on a taper.
Okay.
And a pretty high dose.
Yeah.
So, yeah, which was so scary. Oh my God, that was frightening, because I knew that I needed it.
Yeah.
But I did not know what the side effects were going to be for the rest of my pregnancy and for the baby. So.
Right. So nobody ever told you this is actually going to be okay with this. There's very low risk of, because that's the truth. There's very low risk of.
No one said that.
Okay.
In fact, the OB was panicked.
Wow.
Yeah.
So your OB sounds like of the vein that you shouldn't be on anything.
Yeah.
They didn't want you
Well,
on.
I was labeled as a high-risk pregnancy,
Right.
so they literally treated me like I was a specimen. She was and she was very sweet, but almost to the point of taking care of me as if I was glass.
Yeah.
Most people didn't have as many ultrasounds as I've had.
Yeah.
And I saw her probably more than I saw my siblings, because I was always in her office.
You were always there.
Yeah.
So they took you off everything. You did better, as a third of women do. Then they put you on the prednisone to try to make sure that when you gave birth, things would be better. Yeah. She put you on it.
Yeah.
Okay.
Yeah.
So you weren't under the care of even a gastro at that time because of the insurance situation.
And because he refused to acknowledge that I had UC.
The one that you could see
Right.
was not going to treat you anyway. He wanted to send you home with some preparation H or something.
Right. That's exactly what he did. Yeah.
That's without even doing a rectal exam. That is just, it's shocking to me.
It's irresponsible.
It's irresponsible is what it is.
Yeah.
Yeah. Okay, so you were doing better.
I did really well I did really well as far as the UC was concerned.
Yeah.
For my second trimester and for the beginning of my third.
Right.
I had some hypoglycemia issues where I would get kind of dizzy and, electrolytes were low. I had some iron issues. But other than that,
nothing super out of the ordinary. No. You didn't end up in the hospital or on bed rest or anything like that.
I had one emergency trip, and that was early on.
Right.
It was not, not at all.
So then it comes time to talk about how you're going to have the baby.
Yeah.
What did they say to you at that time?
Well, I had this whole, idea, being, 25 years old and being from Los Angeles and having a mom who gave birth naturally 4 times. I was going to have a water birth. At first, I was going to have a home birth. And then I realized that Jackson's father was squeamish and would have passed out if we gave birth in our home. And then I thought about having a water birth, and then he realized that he would have to get into the water with me, and he almost passed out at the thought of that. So then I was going to have a vaginal birth, and the OB was totally fine with that.
On board with that, yeah.
She totally recommended it.
Good.
She was very much like, we can do this. And then that didn't happen.
Right, because as with all women, you have your idea of what you want to happen.
Yeah,
that's not what happens.
No, and I tell people to prepare for everything.
You have to prepare for everything.
I didn't. My own stubbornness got in my way.
Yeah,
I had decided that I was going to have a vaginal birth, and that was the only thing I read about.
Well, you had no reason to expect otherwise. You had a strong family history of being able to give birth in the way which you wanted to, right. And then things happened. What? Now I know what the end result was, but I don't think I know the play-by-play. So give me the play-by-play.
Well, so I started to flare towards the end of my 3rd trimester.
Right.
And the night of my big sister's wedding, the morning of, I started having contractions.
Yeah.
And the baby dropped. And so we just assumed that after the wedding and the day after, the baby was going to come.
Okay.
3 weeks and about 2 days later, I go into the doctor and I basically tell her that I am about to reach up there myself and grab the baby out if nobody figures this out. Because by that time, I also was having very loose stools, high urgency.
Yeah.
I had left-sided ulcerative colitis, and so the pain on my left side was out of control.
Excruciating, yeah.
And she didn't really understand it. So the more I said, I'm having left-sided pain, she was like, well, might be Braxton Hicks. I'm like, it's not that.
No, it's different.
It's definitely different.
Yeah.
So we went around and around, and on that Monday, I went to her and I was just like, we got to do this now. Like it's got to, whatever we got to do. Mm-hmm. So she talked about Pitocin. She called the hospital, see if there was a bed. She said, there's no bed. Come back Tuesday. Come back tomorrow she gave me like a time, like 6:00. I'm like, what? Oh, I remember, because, you know why? Because Jackson's dad had a meeting. Oh my God, yes, that's what it was. This fool had a meeting in Arizona on Tuesday.
At the end of your pregnancy?
At the end of my pregnancy. He goes to some oil convention with all these oily guys while I'm sitting at home. And so,
ready to drop the baby. Yeah.
Asking to go into the hospital. And yes, because the day we went in on that Monday, I kept saying, we need to get this done.
Yeah.
And she looks at him. I don't know why she even looked at him. She looks at him and she's like, well, is today okay for you or tomorrow? And he's like, well, actually, I have a meeting in Arizona. I can come back after 3. I was like, nobody is paying attention to the person as the human being growing inside of them right now. I don't understand why everybody else's schedules count.
Everybody else's schedule was more important than yours. and your discomfort and what was best for the baby, by the way. Yeah, if you were not doing well, then the baby could be not doing well.
Maybe the baby should have just come out.
Maybe the baby, yeah.
So we get there Tuesday. By this time, I am like oh my God, the bottom of my stomach had stretched. Because we also had figured out that the original date of conception was off.
Yeah,
and
it happens. Yeah.
By couple weeks, and so the bottom of my stomach had stretched, and it was painful, and so I needed help getting out of bed. I needed help getting in and out of the car. I got stuck in my sister's car, actually, which was, I don't even know why she had that stupid short sports car. Stupid. It's just so dumb.
Oh, the indignity.
I had to wait for her husband to come home so I could get out.
Oh my God.
Because she's shorter than me.
Yeah.
So she couldn't lift me.
Lift you. Well, yeah.
Yeah, no, it was.
You had all that baby going on.
Oh my God.
Yeah.
So we get to the hospital and everything seems to be going good. They hook me up to the Pitocin. We're still on vaginal delivery. I'm still having some pain, and so they tell my mom and my in-laws and everybody they can just go and come back tomorrow. So they leave me there, and I end up having a brief moment of realizing that there was going to be a baby coming out of my
you?
That was just I realized this was the end game.
Yeah.
And so I remember I called his dad and I was like, hey, so I know like I kind of like kicked this into high gear, but maybe we could come back tomorrow and then I'll be ready to do it. And he's like, no, we're going to start the drip.
Started. Yeah.
It's time to go.
Yeah.
The next day, everything seemed to be going pretty smoothly. The Pitocin labor is...
Pitocin is a drug that makes your body do the contractions.
Yeah.
Which your body knows how to do it, and that's what your body is for. But Pitocin contractions are more painful and more intense.
They kick them up a notch.
Yeah, than sort of natural contractions, for lack of a better word.
It's like having an omelet and taking, instead of like dropping a couple drops of hot sauce on there to get a little taste, you take the bottle and you break it in half, and then you just dump hot sauce on your omelet.
So did you have, because I had two different experiences. I had back labor with my first, and then the second was a very different type of labor. With the back labor, it was not your contraction, break, constant pain.
Yeah.
Was that what it was like for you too?
Yeah.
Okay.
Yeah. It was nonstop.
That's very, because
it's tiring.
It's tiring because you can deal with a contraction that lasts a minute. You know it's going to end. You know you're going to get a break. When it just doesn't stop.
Yeah. No, it's ridiculous. And then the doula gave, Jackson's dad a job of watching the monitor, which I think in his mind at that time, he was so nervous. Yeah. He thought that he needed to tell me that I was having contractions.
Right.
As if I wasn't feeling them.
Yeah.
I can, if there are any men listening, just want to reiterate that you don't have to explain to your wife that she's having a contraction, because she can feel them.
Yeah.
All the she feels all of them.
So the only time when you need that is when you have pain management that you are not feeling them.
Yeah.
Then you need to know when you're having. That's what the monitoring is for. But when you're freestyling it, you know the contractions are there.
Yeah. And I actually didn't get to the point of being able to have an epidural, because what ended up happening, and because I had so much pain, and when you have that kind of pain, everything's up. You're seizing up. Your whole body is just. You can't come down.
You're
from that.
supposed to relax, but it's you really just can't.
No, and my whole left side was on fire.
Yeah.
I mean, I was having just straight up IBD pain.
Yeah.
I had some blood that was coming out by itself just from, just because. And I remember I looked up and I said, I was like, something's not right.
Mm-hmm.
I think you need to get the doctor. I just remember like I got a shooting pain that went all the way down to my toes on my left side. And then all of a sudden it was like hard to breathe.
Yeah.
Like I just could not breathe. And right when I said that, the doctor came flying in. And Jack's, his heart rate dropped considerably. My heart rate was going through the roof. And I started shaking violently.
Yeah.
And then she came in and she talked about us having a C-section. And when they went in there to get them, the reason why his heart rate dropped is because he had decided he wasn't coming out. He had wrapped, most kids may like wrap themselves up in the cord.
Yeah.
Well, he had wrapped his arm and had also kind of wrapped his other arm and was holding on to the umbilical cord.
Okay.
And was hanging on for dear life.
Yeah.
And had kind of pulled himself away to one side. So they went in and got him, and
how long did it take from when, because what they told me was basically if something occurs, they can have that baby out in like 5 minutes.
Yeah.
So how long?
It wasn't 5 minutes.
No. Well, I mean, that would be an extreme emergency.
Yeah.
But where I labored, the rooms were also, they could do a C-section.
Oh, see, no, we had to move to a surgical.
You had to move. Okay.
Yeah. You know what? I really don't know, because by the time they gave me that epidural, I was like asking for an orange and socks. And
it gets weird.
It got really weird.
Yeah.
I mean, it felt like an hour. Like if I really think about it, it feels like time was just so slow. But I'm sure it was a lot quicker.
I'm sure it wasn't, because when they start to get worried is when the baby's heartbeat drops.
Yeah.
Like that.
Yeah, no, I mean, I remember being wheeled back. I remember the whole shaving and the catheter and all that kind of stuff happened really fast.
Yeah.
But I honestly don't know.
Yeah.
I was also just so tired by the time all that happened.
Yeah.
That I was all over the place.
Yeah.
Yeah.
So your birth story is not the story that you'd hoped to tell.
No.
What are the things that you would tell mothers with ulcerative colitis and Crohn's disease that they should prepare for their birth story?
Well, the first thing is don't be so set on one thing that you aren't prepared for anything to happen. And I would say that to any mom.
Yeah. Oh, that's true for every mom.
Not just someone who has a disease or complications.
Right.
I would have preferred having a GI consult.
Right.
Perhaps a GI nurse as well. Or have a doula with you who understands your disease and understands what's going on and can speak for you. Because, I had a nurse who just kept telling me that the pain on my left side was labor, and I really just needed to calm down, and I couldn't have an epidural, and, labor was painful.
Yeah.
Labor is painful.
Well, yeah, it is.
But
it's different.
It's
pain.
different. It's different pain.
It feels, I don't know if you would agree with me, because your birth story has so much wrapped up in it, but it's pain, but it's productive pain. You sort of understand in your brain that this is going somewhere and that you have to go through it.
Right.
Whereas to me, the ulcerative colitis pain just seems like pain that's just got no purpose.
Yeah, it's got no purpose. It keeps going. At the end of labor, you have this wonderful, beautiful gift.
Yeah.
And that it's like running a marathon. You're getting to a finish line.
Yes.
You just got to keep going.
Yeah.
I would also suggest talking to a lactation specialist.
A lactation specialist before you even, I took some classes.
Yeah, well, you should definitely take all the classes you can.
Yeah.
I would speak to a lactation specialist before you go in, just to get you comfortable with everything that's going on. Because if you do have a C-section, they will tell you the baby may not latch, blah, blah, blah. It could be true. It may not be true. Jackson, he latched on immediately.
Yeah.
And that was not a problem. But I would also talk to someone after you give birth and talk to them about the medications that you're on. Talk to them about your issues with dehydration and all of that. You need all of these things to help you get through the next few weeks of living with this human being and trying to feed this human being and everything, once you leave the hospital.
Right. So that tickled my brain because I want to mention that there's a couple resources. One is Mother to Baby, that they have very, very good data on IBD medications and pregnancy and lactation and all of that, so you can look up things there. They also have specialists that you can talk to.
Yeah.
And then also La Leche, which, I think is a household name. Almost everybody knows that. But there's people there that are resources as well. And then there's also a website called Kelly Mom, which has a lot of good resources. Those were the thing. Well, Mother to Baby wasn't around when I was in that. But La Leche and Kelly Mom were there, and I found a lot of good information there. And then, I went through 4 lactation consultants before they figured out my problem.
Yeah.
So I had to keep going.
Yeah. And also, I would say this because I had mom shamers from a mom group about not being able to breastfeed.
Yeah.
There are donations that you can get. You can get breast milk donations. There are a few different groups. And I think actually they're on my website. I can't remember right now.
Well, we can look them up and then I'll put them in the notes.
Yeah. But you can get breast milk donated. Don't be scared or afraid to put your child on formula. Yeah. I say this to all moms, but specifically moms with any kind of complication, because you don't know what's going to happen after. Like I said, you may have a plan and it just may not work out that way, and that's okay.
That's okay.
Because it happens to everyone. But don't run yourself ragged and stress yourself out over feeding your baby.
Overfeeding the baby. Yeah. I think as adults before we have children, we're used to be having so much control over everything. Yeah. And I honestly feel like even during the pregnancy you have a lot of control. I feel like birth is the first time when you really, really get a taste of what's to come, and that you are not in control of things anymore, and you have to accept changes with some grace and try to figure out how to get through it and do what's best for your family.
Yeah, because the first 3 months are nutty.
They are. You know what? They're my favorite, though. Newborn was my favorite.
Well, because they smell so good.
Oh, it was my favorite.
The smells
and just
all of it.
Just all of it, yeah.
And I actually, I don't want to say I didn't bond with my baby for the first few days, but there was lots of medication.
Yeah.
Lots of things going on. And I really did not and I was just so in change, feed, hold. Right. I was just trying to get it all right. Yeah. That I didn't have that moment of whoa, I'm a mom and this is the most incredible thing until maybe a week later. Yeah.
I think there's that too, because I think some people expect to feel this magical, all of a sudden rainbow thing.
Yeah, as soon as it happens.
Doesn't necessarily work that way.
Not always, yeah.
And so you have to be prepared for that as well. I would say, do as much reading as you can about that kind of thing. Yeah. I wouldn't be afraid. Don't be afraid.
Yeah.
Don't go into your birth fearful.
Yeah.
But go into your birth prepared.
Yeah. And when he was born, it was awesome.
Yeah.
And I was very happy, I was very happy for the whole week, but there was that moment, it was a Sunday, I'll never forget it. Yeah. And everybody had left, and the house was dark, and his dad was doing laundry, and I was holding the baby, and I had just fed him, and I looked down, and he looked at me, and it was oh, look at you. You're mine. This is it. this is so cool.
This is us.
Yeah. It was like, it was magic. And I hadn't had that before.
Oh.
I had looked at him. I mean, he stared at me as soon as they handed him to me, and it scared the crap out of me.
Yeah, yeah.
And, and I think I had started to panic a little bit because I didn't, I would hear these stories about these moms, like, crying and feeling so fulfilled, and I was like, I'm itchy, actually.
I'm not feeling that thing.
I'm not feeling fulfilled right now. I'm feeling like one boob is heavier than the other, and I feel really itchy from the anesthesia.
Yes. Yeah.
So
it presented some challenges, delayed your real deep bonding moment for a little while.
Yes.
Yeah.
And I think also I've talked about this a lot. A lot of us will get the baby blues. Your hormones are going up and down, up and down.
Oh, yeah.
But when you're also dealing with a chronic condition and you got all this other stuff, I would thoroughly suggest talking it out to someone professionally.
Yeah.
Because I didn't know I had postpartum depression until he was about 14 months.
Yeah.
And I went through the whole year.
Right.
Of just feeling completely inadequate and just all of it.
All of that.
All of it. I probably cried almost every day for over a year.
Yeah. Which is, and that's not the baby blues.
No.
The baby blues is a thing.
Yeah.
It's something, this was something else.
This was something else.
Yeah.
It's all of that stacked together. And so I think sometimes we tend to forget, we get caught up in everything that's happening in those first 3 months. You have lack of sleep, you're trying to get used to this new human being, they're doing so many different things. Every day it's something new.
Yeah.
And in a short amount of time that you're not paying attention to yourself. And and you may be paying attention to your health by taking your medication, by talking to your GI, by doing all the things, the structural things that you need to do. But mental health is very important because there's not one person that can bring you happiness. You have to be happy within yourself.
Right.
So
that's a great place to end it.
Yay.
I think you just named the episode. You have to be happy within yourself.
Did I?
You may have. Thanks for sharing your birth story with me.
Yeah.
Like I said, I knew the highlights, but I didn't know the whole thing. Yeah. So that's good. And sharing your wisdom, having come through all of that, so other moms can benefit from it.
I just don't want any other mom to feel alone, because for so long, before I found you guys, there was a lonely journey, and that's not a slap on any of my friends or my family or Jackson's dad, like that. I'm not saying that.
It's not about that.
It's not about that at all. It's just it can feel lonely.
Right. Yeah. So recognize that in yourself.
Yeah, and that's okay.
It's okay,
because you're not the only one.
Definitely not.
No.
All right.
Well,
Brooke, my crazy Creole mama. Thanks.
Thank you.
Hey, that's so cool that you're still listening. I'm going to give you a warm hug. Did you feel it? Before she was diagnosed with ulcerative colitis, Brooke was in the film industry, so she took the skills that she learned there and applied them toward patient advocacy. And now she's dedicated herself to advocating for families that are touched by IBD. Just like everyone else, when patient advocates are first diagnosed, they don't know anything about the disease and they have to learn along the way. Unfortunately, that sometimes comes with really, really hard lessons. And while I wouldn't wish that on anyone, a patient advocate comes out the other side, has learned from those things that have happened, and takes that information and tries to make sure that it doesn't happen again to patients that are newly diagnosed or who are going through the same situations in their disease journey. Special thanks to Brooke Abbott for sitting down with me and telling me the entirety of Jackson's birth story. He's quite a kid. If you follow Brooke on Pinterest and Instagram and the Twitters and the Facebooks, you'll see all of the shenanigans that they get up to. And it's very, very cool. Look in the show notes. I've got links to all of her social media information, as well as all of my social media information. And remember, until next time, I want you to know more about IBD.